The Desert Healthcare District and Foundation presents a podcast that supports your health and wellness where you live. This is Healthy Desert, Healthy You, hosted by Will Dean. Now, here's Will.
Hello friends, welcome to another episode of Healthy Desert, Healthy You. Our guest today is someone I think you're going to find really interesting. Mihai Patru is the Executive Director of Blue Zones Palm Springs. He is a former diplomat and social entrepreneur with more than a decade of experience that includes small business creation, community development, and cross-sector collaboration. I am particularly excited because he is going to be on a panel at the third annual Healthy Desert, Healthy You Summit on September 10 in Rancho Mirage. Welcome, Mihai.
Hi, Will. Thank you for having me and for having Blue Zones on the podcast.
I'm very excited to talk with you because Blue Zones, that is a phrase, a name that many of us have heard, but I'm not sure everyone understands what it is. So if you could give us a brief description, definition of Blue Zones.
Well, Blue Zones is a national organization whose mission is to make healthier choices the easier choices for communities. Blue Zones Project Palm Springs was launched a little over a year and a half ago, March 2025, and we are in the middle of what we call transformation period that will end in March 2028. And by that time, Palm Springs will become a Blue Zones certified community.
So what I'm hearing is that it sounds like a lot of the programs, the services that residents will benefit from through Blue Zones happens during the transformation period before you get to the certification.
Exactly. Think of it as we have 3 years to build infrastructure in the community in Palm Springs to continue well-being strategies. We focus on 3 pillars, just like the foundation. We have people, and that covers all the programs we do in communities, all the community interactions with residents. The second one is places, and that's how we work with any type of organizations, from restaurants, from work sites, from grocery stores, nonprofits, any type of organization that is interested in becoming Blue Zones approved. And the third one, equally important, is policy. That's where we work with the city, with other stakeholders. We are supporting new policies, helping organizations draft existing policies. So we think, we need good policies that provide additional infrastructure for well-being strategies to be implemented effectively in the community.
Can you give us an example of what a good policy would be on this road to certification?
Of course. For example, we are very focused on access to food or policies that discourage smoking in the community. Also, we had a couple of campaigns that educate community members around drinking while driving, discouraging that. So this type of policy is, and we work with the city, we work with organizations that are involved in that sector.
Oh, wow. Okay, so I mentioned that a lot of people have heard of Blue Zones. What do you think is the biggest misconception about Blue Zones?
I think we have, in general, and myself included before joining Blue Zones, our immediate thought when you think about well-being is everything stops at food and movement. But everything actually impacts well-being. Policies, as we just mentioned, safety in our communities. If a community is safe, the residents are willing to take walks, right? Go outside. So everything, I think nowadays we talk about well-being from so many angles, and we are looking at well-being as a big puzzle. So everything, access to food, access to transportation, public transportation, shade, built environment, everything contributes in different from different angles to improving our lives, making sure residents live healthier, longer lives.
Right. So shade definitely here.
Shade, especially in Palm Springs and the city. We work to get closely with the city council and different departments in the city. This concept nowadays of radical shade. So we contribute with our expertise and that larger conversation. How do we address shade in Palm Springs?
So we have a beautiful community. Many of us living here absolutely love it. So could you talk about what the community of Palm Springs is already doing well that makes it sort of ideal for Blue Zone certification?
I think in Riverside County, Blue Zones is implementing currently 4 projects, Banning, Palm Springs, the city of Coachella, and the city of Riverside. From my perspective, I think in Palm Springs, from our experience, a lot of people moved here because they wanted a better lifestyle. So the conversation is easier. When we go out in the community, engage with different stakeholders, people love Palm Springs, love their lifestyle here, and they moved from busy cities like San Diego or LA, San Francisco, New York, because they wanted to have a different lifestyle. So that first introduction into well-being is already there. I think what's different is how do we implement all the lessons learned by Blue Zones in other communities, all the strategies. We talk about Blue Zones as a community-driven initiative. We have tools, we have the strategies, but each community is different. The implementation is different.
Right.
What works in the city of Coachella in terms of implementation might not work in Palm Springs, and the other way around. So that's, I think, the beauty of working in a community like Palm Springs. Residents are already on their way to build healthier, longer lives. And I think for us is just guiding that conversation, providing more tools, and educating people about what's available out there. And a lot of the things are already available in the community.
Right, yeah. That's a really good point about this community being open to it, people moving here for that reason.
Correct.
What are some of the challenges in Palm Springs to implementing this project?
I think the weather.
The weather, yeah.
Especially when it comes to community engagements. We do a lot of activities, from workshops, cooking demonstrations, and we can be very creative. Well, being outside when there's 120, that's pretty challenging. So
very challenging.
We think of through different partners, having events, having community interactions where people are safe. So that's probably a natural challenge. There's nothing we can do about it. But really, I wouldn't call it a challenge, but more of we have to think creatively. How do we communicate what we do? How do we get people involved? And I think, like a lot of communities in the desert, we live in behind gated communities. A lot of social interaction, although we think of Palm Springs as a very party, social community, and it's not. How do we interact with residents that don't live their communities? They're happy with the amenities they have within their small community. How do we connect with them? Right. Whether through events or through other partners that already have that interaction. And it's also about building trust. We know that showing up where people are, and that's very important. And also leveraging the trust that other partners have, whether it's a nonprofit, whether it's the school district, whether it's a school. We leverage those relationships so people learn more about Blue Zones. People learn how they can interact with us and be part of what we do. As I mentioned, Blue Zones is in Palm Springs only for 3 years. But we want to make sure that what we do now, we focus on sustainability and longevity of our work. So we want to make sure that community members or organizations, they feel that they own what we do. They own what the programs that we implement. So that ownership, feeling that ownership, will allow these initiatives to continue 10 years from now, 15 years from now, because the community understands and experience directly firsthand those benefits.
Right. So to be sure that I'm clear on the timeline, when you refer to Blue Zones being here only 3 years, that's the implementation period?
Yes, that's the transformation period.
And certified in 2028?
Yes.
Okay.
And think about, we work with restaurants, for example, and really bringing all the lessons that Blue Zones has learned in over 75 communities where Blue Zones has implemented well-being strategies.
In the States or worldwide?
In the States.
In the States, okay.
So we bring best practices, we bring new recipes that the community will have access to healthier meals, healthier options, and that's the whole idea around making healthier options easier options.
Right. All about health, which is the main topic and impetus for our health summit, of which you're going to be a part in September. And you're participating in a panel, I want to get it right. The panel is Advancing Community Health Through Employment and Career Pathways. I know here at the district, one of our challenges, not only at the district but in the community, is the quantity or the number of healthcare providers that we have. We have a shortage. So I'm wondering, in terms of your professional experience, what are some ways we need to be thinking, ways we need to be moving in order to address that?
Under the places pillar, we work with work sites.
Okay.
And unlike restaurants or grocery stores or other for-profit or non-profit businesses, when we work with work sites, we really focus on the experience that the employees have in a Blue Zones approved work site. So I think the immediate consequence or impact is retention, right? Creating that work environment where employees and staff feel appreciated, feel that they have healthy environment that they go to every day. Data says that we spend 90,000 hours at work. So imagine spending 90,000 hours in an environment that is not healthy, doesn't support your well-being journey. So
and you don't want to be there.
Exactly. So I think that once an employer offers that type of environment that is really catered towards creating a well-being environment, the staff, the employees want to be there. So retention is higher, the quality of life of the employees is higher, so the benefits are there. And it also attracts new potential staff because they like to be in an environment that supports them. And when we work with worksite, it's really we are looking at a lot of aspects that a worksite covers, from simple things like access to healthy snacks, simple things like, is there a bike rack around your office, so that incentivizes your interest in biking. You can bike from home to your office because you know your bike will be safe. Are there spaces where your staff can can downshift, can relax for 10 minutes between, challenging calls, or in the healthcare sector, between shifts, or when the day is very busy, you have, a lot of patients. Is there a space where you can just close the door, and for 10 minutes you can relax. So things like that. We are also looking at the benefits that an employee has in that particular work environment. And if those strategies or those best practices do not exist, we work with that particular work site to improve them. If they don't have policies around smoking, well, we help them create those. We bring templates and we work with that particular employer to adjust them to that particular business. Mm-hmm. So there are a lot of aspects that we connect them with other partners. So the employees benefit from other services that exist in the community.
Mm-hmm. So worksite, that's very important. When I hear career pathways, which is part of the title of the panel, I think about our educational institutions. Is Blue Zones doing any work with those as well?
Yes, we are very involved with the school district. Actually, the school district is our most recent Blue Zones approved work site. Mm-hmm. So that's another really creating that well-being environment in schools, both for kids, but also for the educators. And I think the impact there working with the school district and with the schools is huge, because the kids, the students learn about well-being strategies, about nutrition, about movement, about all these things that impact our well-being, and they go home and they share those lessons with their parents. So hopefully there will be some adoption of these strategies at home. And I think, that's how it's a long-term game, but having the right partners, having the right strategies in place, I think that can go a very long way.
So I appreciate that you've talked about approaching well-being from many different aspects. So I'm wondering is there one major action that you would like to see, even if it's from the city level, to really push this forward more? Is there one big action that needs to happen? I
think what we've learned is there isn't one big thing that if we do that, we all live healthier, longer lives. There are especially the small things that matter. Mm-hmm. It can be, more restaurants in Palm Springs offering healthier options. And by that, I don't mean only the recipes, it's also the quality of the ingredients. So we work with restaurants and connecting them with small farmers in our communities. So they buy fresher products, better quality products. So those are reflected in our menus and the dishes we have access to. Planting trees in our communities. We've been working with faith-based organizations or other HOAs and helping them design and build community gardens. So the residents or the students at the different schools have a place where they can learn about gardening, but also about nutrition. We work with the community Ramon Mobile Park. We help them build their community garden. When obviously movement is a huge part of well-being, but it's not only about going to the gym. At Blue Zones, we think about movement, any type of natural movement. Gardening is a huge part of that. So just spending an hour gardening, that has an immediate impact on your physical well-being, on your mental well-being. So I think all these small things contribute policies around organizations that commit to using, when they have events, prioritize healthier options when it comes to their food offerings. That's a huge step. So create, whether for their guests or for their employees, easier access to those options because they are there. So just that commitment is such an important part. We are working with the city. We are advocating for including healthier options when it comes to food for contractors that offer, cater events. that are public events. Well, if there is an incentive or those contractors are encouraged to offer healthier options when it comes to food, that's a huge win. So there are all these small things, part of our daily routines, part of our daily actions, that if we improve those and make them healthier options, that's a huge win.
Absolutely. So you mentioned there are 75 communities in the States that either have the certification or are working toward it.
Yes, correct.
And every community is different, but I wanted to give a shout out to any community that you think is doing it really well.
Fort Worth in Texas is a big example.
Okay.
So that's kind of, there are so many lessons that we learn from our communities, and those go into our strategies. So I think every community brings something new that hopefully will be replicated in newer communities, in newer projects.
Right, and so there are many benefits for residents, of course. What about in terms of the city's appeal to tourists and new residents, new people coming in, because that's really important in terms of also developing our workforce in healthcare and other areas.
Yeah, I think we've seen so many changes in Palm Springs. The new residents, if before COVID, people moved to Palm Springs to retire. We know that during COVID, a lot of people moved to Palm Springs for work. Working remotely, new talent has moved here. So I think having a community that promotes well-being, that has infrastructures in place that makes it easier for newcomers to be in Palm Springs, that's a huge win. It's also about if somebody is looking to move to Palm Springs for work, they want to make sure that they have good schools, that the schools are promoting well-being, that they have healthier options. So that I think Palm Springs embarking on this journey will eventually attract tourists. We talk about hospitality economy, but I think in Palm Springs we can talk about well-being economy. Absolutely. Right, we have so many, the spas, we have all the resources, the hiking opportunities, the walking opportunities. So people come here for that. So
since the beginning,
exactly. Yeah. So it's maybe adding that, being more intentional when we speak about these opportunities from a well-being perspective. Mm-hmm. So it's not only about attracting a new group of tourists that are very intentional and looking for areas that support well-being, but also for new residents that want to move to Palm Springs and are looking for work, whether for that's such a huge attraction. And I think for the big organizations here, when they want to attract new talent that might not be in Palm Springs, it's not only about the salary, it's not only about the benefits, it's what kind of community can we offer you. And I think well-being and having those structures in the community nowadays it's extremely important.
Absolutely. So for the residents who are already here, what is the best way, or how can residents support this Blue Zones effort? What should they do? What should we do?
Engage with us. We have a lot of events. Our website is always updated, and the most important thing is we know what we know, or we don't know what we don't know, and it's always we try to engage, being in the community and learn. What do you as a resident want to see? We have some resources, we have all these strategies. You as a resident, you can guide us. Maybe strategies that work in Fort Worth or other, as we mentioned, might not work here or might not be that appealing to the residents. So the residents need to tell us, oh, this is what works for me. Even if, the time of the walk that they want to take, or the groups that they are interested in joining, all that we learned, all those aspects from the Palm Springs residents.
Right, as you've said, it's very community-driven.
It's very community-driven because we are building something that we want to make sure is sustainable. And the the only way to do that is for residents, for everyone in the community to feel that they own it and that they shaped those strategies to make them their own.
So is there a website that people can visit?
Yes, I think easier is Blue Zones Project Palm Springs on Google. It's just, we are on social media, very active. And on our website, everyone can see the events or just reach out to us. The first step that we encourage community members to take is the pledge. It's a very simple form, and it's really kind of the first step of committing to start a journey towards well-being. And that's how they get on our emailing list, and they get emails, they get notifications about events, about celebrations that we organize in the community, and also a way for them to communicate with us and reach out to us.
Oh, very good. So is there anything that you want to share that I have not asked you about Blue Zones?
I think it's just a call to action. Really, everyone start their well-being journey, and the first step is really engaging with our team.
Mihai, I look forward to seeing you at the summit in September.
Likewise.
Thank you for being on the podcast.
Thank you for having us.
All right. There you have it, everyone. Thank you.
Thank you for joining us on this episode of Healthy Desert, Healthy You. This podcast is a production of the Desert Healthcare District and Foundation in Palm Springs, California. For more information, please visit the website dhcd.org. Our annual conference site is healthydesert.healthyu.com. This podcast is available at most major podcast portals, including Amazon Music, Apple Podcasts, Audible, Captivate.fm, Spotify, and YouTube Music. Thanks for listening. Be sure to subscribe.